Television portrays smoking in a strangely positive light. Over the past many decades, we've come to acknowledge the harm cigarettes have done, and television media is no exception. But there's one area where they seem to lag and give a wrongful impression: mental health. Still to this day, we see images of characters going through great stress and anxiety resorting to smoking a cigarette. Often we see the hero having an argument or a stressful moment and then going outside for a cigarette. Usually, this is portrayed as out of character for them. This, however, sends the wrong message that tobacco use is for managing anxiety and stress. In reality, tobacco use can often exacerbate mental health problems and lead to addiction. What is needed is a more accurate representation of tobacco use in media. An organization called the Truth Initiative began tracking tobacco use in media in 2018. Startlingly, streaming services have increased depictions of tobacco use by 110% in 2022. This, they say, exposed 25 million young people to tobacco imagery. Research from the Truth Initiative shows that such imagery can increase a person's chances of starting the use of commercial tobacco by upwards of 3 times. The relationship between tobacco and mental health is often overlooked. People with mental health issues are twice as likely to be commercial tobacco users. 35% of all people who smoke tobacco and have a mental health condition. They account for 38% of all U.S. adult cigarette consumption. To make matters worse, people with a mental health condition are twice as likely to use tobacco as self-medication to relieve symptoms of a mental health problem. But this is a short-term solution that creates a cycle of tobacco and/or nicotine dependence and mental health issues. People with mental health struggles smoke at much higher rates, contributing to a high disparity impact of commercial tobacco, such as earlier death on these individuals. We are working towards integration of tobacco treatment and recovery into mental health and substance use treatment settings across the state of Minnesota. More professionals in these programs are realizing it is a powerful way they can support their patients and clients into full, long-term recovery. The research shows the opposite of what television and streaming services are showing adults and youth. Quitting tobacco use can actually decrease levels of anxiety and depression and stress. This in turn improves quality of life and creates a positive mood. A systematic review and meta-analysis showed that quitting smoking was equal to or more effective than antidepressant medication for mood and anxiety disorders. Unfortunately, the media will continue to portray tobacco use in movies and television in an incorrect and unhealthy light. It is certainly no coping mechanism for emotional turmoil and stress. Sure, they portray a short-term relief of symptoms, but they do not portray the long-term effects of tobacco use on mental health. The reality is that they cause mental health challenges to become worse, perpetuating a terrible cycle of dependence and deteriorating well-being. Thank you for watching. If you like this program, then please head over to my Patreon page and set up a monthly donation. It's your donations that keep this program running. Also, if you would like, please rate, comment, subscribe, and share in various social media.